Hi, everyone. Welcome back to another episode of Ask Dr. Leila, where again with our beautiful specialist orthodontist, Dr. Gayatri Mago is here with us in the studio.
Thank you so much for having me again. Looks like I'm becoming a permanent resident of the chair with you, Dr. Leila.
That is amazing. I absolutely love that.
Me too.
So in our last episode, we explored the connection between orthodontics and psychology and touched on some of the ways patients can manage dental anxiety. But today, I want to focus more on the practical strategies that can help patients feel calm and comfortable during their dental visits. So let's start and just jump in.
Yes. So I think I know what you're getting at. I know that you're talking about mindfulness. And if you just break down the word mindful, what do you think? What's your first instinct? What does it mean? Mindful.
That everything you do, you don't do it just passively, but you actually use your mind for it.
Exactly. So if I put it contextually, it's another way of saying that you're aware of what you're doing, basically self-aware, right? So it can have different contexts. For you as a dentist to be mindful, you might be perceptive of your patient's feelings, your patient's needs, your use of dental terminology mindfully, where you talk about dental treatments with using different analogies,
Correct.
which are easier for patients to hear, using euphemisms instead of saying we need to have your tooth pulled. Use a lesser sort of daunting word like
Yes.
I need to remove your tooth, or this tooth has to go, because it doesn't immediately
Or we wiggle it
spark.
out.
Absolutely, that we could use for children.
Yeah.
That
And adults, I do. I'm one that does
yeah,
that.
you mother your patients. I
Yes,
know.
yes.
So yeah, I mean, it's about being mindful in everything, right? And the other term, mindfulness, that we've all come to be conditioned to, that is to define meditation or to rewire focus back to your own thoughts,
Correct.
right?
Yeah.
So mindfulness in the form of meditation basically is to be aware of your own thoughts, to let them come just as you breathe naturally. Your mind is going to be active. You're awake. You're going to be a part of your environment. Your environment is going to stimulate you in different ways. And that's about being alive, right? That you're taking it all in. So how do you expect to not have thoughts about it? So mindfulness is not about blocking your thoughts out completely. It's basically about letting the thought pass, observing it. Observe. This is my thought. What is it telling me? Do not judge the thought at all. Let it move on. Next thought. Observe. Let it move on. What you are doing is basically, by not judging the thought, you're detaching from it. You're detaching from that thought. So when you're anxious in the chair or just before an appointment, observe the thought, recognize the thought, let it pass. As that anxiety related thought passes, you will keep achieving a sense of calm that basically is going to help you get through your appointment. Yeah. You can also practice some breathing techniques if you're very wired or riled up before an appointment. So you could, before in the reception area, find yourself a more quiet spot and you can just breathe. So there is basically a 3-step breathing program. We call it a diaphragmatic breath. So you need to have your lungs full, right? When you're anxious, what is the natural somatic or physiological response of the body?
Quick breathing.
Quick
Shallow breathing.
shallow breathing, tightness, that release of cortisol and epinephrine. It just completely, scatters your brain, your entire thought process. And, you're feeling palpitations, you're feeling like sense of doom.
Correct.
Right? So that means you're perceiving something in your environment as a threat. And whenever we perceive anything as a threat, we either try to fight with it or we tend to flee away from it, right?
Right.
So we're basically activating our sympathetic nervous system. Yeah. But if we had to control how we breathe, then how do we counter the sympathetic nervous system? By activating the parasympathetic nervous system.
Beautiful.
Yeah. So then with breathing, basically, as I told you, it's a 3-step process. You can try it with me right now. Yeah. So just undo
I just
your
want to
legs.
point out something. I'm actually one to say this a lot. We live such a robotic life. From morning, the moment we get up to nighttime, and then we say, "Why is life just flying?"
Yes.
Well, it's because the moments are not really moments. It's like a big blur.
Yes.
And what is the difference between us and the future robots or the present robots and AI is, we want to be mindful. And that's something that I don't think AI is going to be, and that's how us humans cannot live a robotic life, which a lot of us are complaining about,
That's
I must
correct.
say, right?
That's correct. Yes. So, I mean, we should honor the cliche, stop and smell the roses.
100%.
Because you need to. And again, beautifully put across, when we are so mechanical, it's again stress hormones
Yes.
that are actually driving your day.
Right.
Every time you feel something, what's activated when you need to get the next thing done on your to-do list, you're already stressing about it, that I'm on number 5, I have 10 things lined up on my to-do list,
Right.
and there's only 2 hours left before my shift ends, and I need to get this done, and for tomorrow I need to look into things. So you're always thinking about the next event.
Correct.
And to cope, your body is naturally releasing a lot of cortisol. So now imagine that it's your day off, but you woke up in the morning, your body is doing your stuff for you. It is releasing the amount of cortisol that it thinks that you will need to get through your day. That's why if you're not mindful, if you don't take breaks, if you don't relax, then even on those days,
you will never rest.
you will not rest, and it will mimic that sense of threat or anxiety for you, so that your glands can release the cortisol basically, and the body can get it as a drug it needs to survive, right? That's why I'm sure you've come across the term survival mode. Yeah. So,
but that's horrible. We don't want to be on survival mode.
We don't, because there is no threat to our lives. I mean, when you scroll through Instagram, and there's this joke that, there's a meme where someone's actually scared when they go hunting back in the days where people were hunter-gatherers.
Yes.
And then there are these people with the similar response to an email from their office.
Yes.
Right?
Yes.
We have to understand that the worst case scenario is only in our head.
100%.
And 99% of the times, these worst case scenarios do not
never
play out
come
as we think that they do. And that's why sometimes I feel that,
and we can all reflect on this. It's so true. And yet we forget. The next morning we get up and it's like the same old again.
Because again, everything is a pattern, right? So
let's break the pattern.
Let's break the pattern. It's very important, because even though, we were all raised to be something in life, and all our lives we've worked towards a goal, and you reach, say, in your late 30s or 40s, now there are no directly rewarding goals, right? Because when you were studying, you took an exam, you worked hard, you got a great grade, and yes, boom, you
Check
got
mark.
you got your reward. But here you are, you're doing dentistry, for example. You're doing the same thing technically every day. Of course, we all love it. We're so passionate about it. And when we meet people, all of their energy gets fed into us. Our energy gets fed into them. Because of that exchange, we love what we do.
Correct.
Right? But still, it is monotonous.
Yes.
And it is mechanical. And not every day can you get a quantifiable reward from your place of work.
Correct.
Right? So other aspects of life also have to be rewarding.
Correct.
Because you can be easily replaced from everyone's lives, but then you still have to continue to live with yourself. Right? So again, life is all about coping, because technically suffering is inevitable.
Right. Right.
But it doesn't have to be.
Mm-hmm.
You don't need to suffer
Right.
because you don't have a choice with everything that happens around you.
Right.
Right?
Yeah.
So if you again come back to mindfulness and pause and reflect on every bad day has something good that happened to you.
Yes.
Write down that good.
Yeah, that's the journaling. They
Breathe
say
into that.
before you sleep, write down all the good positives of the day.
Even if it is as simple as you were stuck in traffic, but you let somebody else pass before you. You know, it doesn't even have to be helping somebody actively by making time to go somewhere.
Correct.
Just as small as, you know, letting somebody ahead of you in a coffee line, anything like that.
No, but you're so right. It doesn't have to be. So when patients say, is this going to be painful? I always say this. I'm like, it can be, but it doesn't have to be. And we have techniques, and those techniques are on us, you know, the dentist, to try to make it as least painful as possible. So it goes with our lives as well. It doesn't have to be painful. It doesn't have to be all suffering. It doesn't have to be hard to say, you know, I did it. You know, there's definitely techniques along the way that we can, you know, enjoy the process as well.
We have
say the least.
to. We have to. We should. Because if you then look back when you're really old, what is the point of it? And how can your whole life be a blur? If you know what I mean, right? You have to have memories that stand out. And when you were a child and, you know, you had festivals and family getting together. Now imagine until your early 20s, all of these memories are so consolidated. They stand out. Even now at family gatherings, you meet people, you talk about things, and you all have an exact like, oh yeah, this is what happened. Somebody was wearing this. This is what we ate. But then now, because everybody is so stressed, and say you were supposed to talk about me for 3 minutes on my birthday party or my retirement party, it's so difficult to, you know, think about anything that stands out.
People don't communicate, Dr. Mago, anymore.
Absolutely.
The thing is that we are so preoccupied with our phones or television or whatever else that we don't spend time one-on-one anymore.
Yes, or even going back and gathering your thoughts, just as, you know, like you have to remember what you did. Sometimes if you just sit with yourself for 5 minutes and just breathe, your thoughts will generally be about the day you've had. At least recognize the thoughts. Like, go back
and award yourself for the good things you did.
Exactly.
Yeah.
So it's so important, again, to be mindful, you know, coming back to what we were discussing.
And it's amazing that just some breathing techniques can make us mindful.
Exactly.
Dr. Mago, there's another effective technique, which is progressive muscle relaxation. I oftentimes say to my patients, do you want to squeeze this squeezy ball? Am I correct by saying that?
Actually, you are. Some patients might not find it easy to meditate and relax. So the technique you brought up is actually very helpful because it's sort of like a distraction technique. You're deviating from your thoughts and focusing on your body, right? So it's basically learning to understand that your muscles are tensed when you're anxious, right? So you go through this technique by actively squeezing muscles throughout your body from head to toe and then relaxing them. So you squeeze a muscle, you relax a muscle, and you breathe alongside of it. So your entire focus is on, yes, I'm tensed, but look, I'm relaxed. Okay? So you're being aware of the tension and then you're actively taking control and relaxing the tension.
So you know the difference.
So
I think then if I look back, it was sort of quote unquote mistake to have patients hold the squeezy ball the whole time.
No,
because I see people holding it and squeezing it throughout the procedure, never letting go.
Yes, so that is somewhere we could correct them. Because if
not that they were in pain, but they just feel that, you know, they're afraid to let go. They're just holding on, you know, like that's the right thing to do.
They're holding on to it like a comfort toy. But if they held on to it properly, wherein they squeeze and relax in alternate motions, then they would be able to use it more effectively. right? So
You have your bear today.
yes, I actually stole it
Polar
from
bear.
Dr. Safa. Credits to Dr. Safa. So squeeze it,
Okay.
but not just squeeze it, as tightly as you can. Now your brain can perceive this tension.
Interesting.
And then take a deep breath in. As you exhale, release it. So now
Okay.
you're using it more effectively.
Okay.
Because when you tell yourself that you can relax, what are you telling yourself? That you can relax. Right?
Beautifully.
So it takes away
Thank
the
you for
anxiety.
that.
Yeah.
So I'm not going to mention to them to relax and unrelax squeeze. There are all the muscles of the body, which is a technique they can do at home. In the dental chair, I don't know if that would work, but at least just squeezing the ball or the white bear or any of this and letting go, I think is good enough. Correct?
It is. It is.
Fantastic. Thank you for that. I think that will help for sure our patients and the dentists out there.
One other thing that I'd like to bring up is we're often more critical of our own selves than of somebody else, right?
100%, that's true.
Yeah. So if I were to go for a dental appointment, what would you as a friend or colleague or a mentor or anybody tell me? It's okay. It's going to be fine. You got this.
Right.
Remember, you had one last week and everything was fine and you came back feeling so much more confident
But
about
that same
it.
person, if they come, they have the same or worse.
Yes. But
Thoughts.
because they are not self-compassionate,
Right.
because they don't tell themselves or go back and count their own strengths, that generally they get through it very well. And it's okay to be anxious. It's totally fine. The feelings, the emotions are completely valid, but you'll also get through. And the good part about any appointment is that it's time bound,
Yeah.
right? So you just have to prepare yourself for 30 minutes, for 20 minutes, and we can all do that.
Right,
We're all resilient
right.
enough to do that. So if you practice self-compassion, if you tell yourself the same thing you would tell a friend and follow it up with this same breathing technique, as the breath goes through your body, the positive thoughts that you're trying to generate are also going through your body.
Correct.
Right? So you start feeling better about it.
Right.
Right? And another way to meditate is to use guided imagery. Right? So recently I had to have an MRI on my back. And I'm usually very claustrophobic in the machine. So it was freaking me out a little. I mean, guilty, yeah. But then I went inside and honestly, my next goal in life is to have a house and me decorate it, yeah. So I'm there in the machine. I'm trying to breathe, relax myself. And I was decorating a house. What would I like? Where? How would I want, the sofa to be oriented? Where would I want my paintings to go? Which is going to be my photo wall? How do I want to line my, staircase or whatever? And before I knew it, I still had a few things to get done. I was still planning the awnings for, here and there before it was time, and she was pulling me out, right? So what is fear? Fear is also our imagination of worst case scenario, what we think is going to happen to us in the chair. So why not use that imagination constructively and maybe online shop in your head or, decorate a house or see yourself being in your happy place or
Correct.
a meadow or something like that.
Yes.
And you can always include that in a patient's history, like what's your happy place like, right? So someone says, I love going to the beach. Then why not have surround sound speakers and play the sound of waves, right? So basically you're just inculcating a 4D experience,
Right.
wherein if the patient is mentally at the beach and another like sense, which is hearing, is also activated with the sound
It
of...
helps a lot. Yeah.
It helps
I
a
often
lot.
say use my dental chair as a sun bed.
Exactly.
And then they look up on the TV and it's usually something by the ocean. So, but I am assuming that everyone loves that. So you're right. I should ask maybe if the ocean is not the right place for everybody. But I often say put yourself in the most beautiful place or anywhere but in the dental chair.
Yes.
And how else can I mean, what you have said are great techniques for patients, but how can I as a dentist help more in this process as well?
So basically, again, wiring back to being mindful, right? As the patient, maybe if you've met them before and you know that they're generally anxious, just try to greet them at the reception. Give them 2 minutes of your time, make some small talk, ask them how they're feeling that day. If you don't know them as well, it's a good practice to then go say hello, talk about things, ask them some things about their history outside the office itself, so that they're already settling into what they're there for, what it's about at the same time, because they can see more of your body language,
Yeah.
your sense of calm, then they'll start adapting to you more easily like that.
Correct.
Right?
Yeah.
One other tip I'd like to offer is our assistants, our lifelines, our backbones. They're super
100%.
trained
Yeah.
for everything, right? So instead, when you've had taken the first appointment to get to know the patient and build that trust with them, no matter how well trained your assistant is, try to do even a simple procedure by yourself, right? If it's a simple thing like making an impression, doing a scan, doing anything, just focus and try to do it yourself, because the patient has just put their trust in you.
Yeah.
And if you introduce another person, then it's again a change of
Right.
environment. They get shifty. They feel like,
Correct.
I just trusted her. Am I going to be safe with the next
Yeah.
person? So that is something one can stick with.
I do that. I don't know, unfortunately or fortunately, but I mean, I do what I mean is I take control almost on everything.
Everything.
A to Z. Almost, I can say A to Z. And at times I think I shouldn't. I mean, but it's for that real reason. Is because I always feel that patients have the trust
In you, yes.
and we've already had this relationship. So I've been accused by even my colleagues and my family that, Leila, you just overdo it, or you're too involved.
You don't
I
delegate.
don't realize where do I stop the involvement? It all for me is part of it. I
True.
cannot pull myself back, honestly, you know.
But why do you need to? Like, I mean, forget about everyone else's opinion for a second. This is something that has always worked for you,
Correct.
right?
Right.
And what's the flip side? Is there anything that's a negative consequence of you being like this?
No, because I get enjoyment out of it.
That's it. That's your answer. You don't need to have an opinion on something that really works for you.
Yes.
Yes. If others around you feel that you can't put your trust in them, you can make them feel good by saying, I find it hard to delegate, and this is the way I operate. Because, I mean, that works for you, right? And I think even for the patient, they know that we went to dental school for 5 years. We've had extensive training. If you've done your post-graduation, it becomes at least another 8 years. So it's very easy for them, because you're the authority figure. You're the trained professional, to trust you more than the next person. So I think if you know that, your patient is anxious and you've built rapport, it's very important that you execute all procedures no matter how minor they are. I think that as a patient would work for me the most.
True.
Right?
Yeah, yeah.
Another thing, it's a small tip, again, because we wear these surgical gowns and they're absorbent, right? If the patient is not allergic to anything, it would be nice to put a drop of essential oil, like a lavender oil or something. So when they're breathing deeply, lavender is supposed to be very soothing,
Right.
very calming, So it may have that influence where it helps them relax
That's interesting, because I've always
a little
known
bit more.
not to put perfume, because some people are sensitive to perfume.
Yes.
Actually, the more I listen to podcasts, perfume can, cause some issues with ourselves. But in any regards, so I always think I'm in a profession where, my hair is up, I have a cap on, half the time I look like a chef, but it's okay. That's all good. But yeah, for the smell, maybe the lavender could be
Yes.
something that I
And
could try, because
it's
I
not
don't
a-
put any. I don't put any.
It's not a perfume. It's just an essential
No, that's
oil.
an essential oil. Absolutely.
And another thing is, again, coming back to communication, you're seeking permission. Like, people are all, when you say lavender, I know what you're talking about. When you say orange, I know what you're talking about. Similarly, everybody, as all these experiences are learned, we have so much perception through different senses of our body. It's good to ask. If it works for that patient, it can be
Great.
tried.
Yeah. But it's
Right?
not for everyone again.
It's not for everyone.
Yeah.
Yes.
Nothing is for everyone. And that's something it's key to for our colleagues to know that any of these things we've said, or maybe that you're doing, I always say, again, I said it last week, that we are mini psychologists. I didn't study any psychology. Dr. Mago is presently, she's studying psychology, which is great. I think that just makes us even better healthcare professionals. But really, we need to scan the patient
True.
and in our mind know what works. And if we don't, it's okay to ask.
Yes.
And say, I'm in this with you. Sometimes patients say, I fear this. I said, I do too.
Yes.
And
Self-disclosure.
Yeah. And I'm saying this moment, maybe, I'm going through this with you. We'll get through this together. Or when I sit in the dental chair, I get heart palpitations every single time. So I understand what it means to be fearful of seeing the patient.
True.
So I really thank you for this. I mean, these tips, and I know we can talk about this all day. There are so many things that, but for sure, all that you've talked about, the ones that I've tried, have helped immensely.
True.
So these, do try these tips for the dentists out there. And for everyone listening, thank you for listening. And I look so forward to our next gathering with our lovely Dr. Gayatri. Thank you, Dr. Gayatri,
Thank
for
you so
today.
much for having me again and for doing the breathing exercise with me. I hope it helps.
It did. Actually, immediately,
You
I don't
felt-
think it's placebo. I felt everything just relax and calm
True.
down. And that was just a very short time.
Yes.
So it works. Thank you all again. And until next time.
Thank you.